Hi, everyone. Welcome. And thanks for joining us tonight here on our YouTube channel. I'm Darcy Furness, and I'm just going to make sure I've muted our live stream here. Here we go. Perfect. So I'm Darcy Furness, and I'm the nutrition consultant here in our South Surrey location. And I'm happy to say that we're now able to resume our free nutrition consults. Sorry, I'm just having a bit of trouble here. Got some playback happening. There we go. Okay. That's better. Thanks for your patience. Just a little bit of a technical glitch there. So if you'd like to take advantage of our free nutrition services, we're now able to offer them again with COVID protocols in place. So to do that, just reach out to your nearest Choices Markets and nutritionist there on staff, and she can let you know how she's sort of managing things during our pandemic. And a great way to stay in touch with all things health is to visit our website at www.choicesmarkets.com and also sign up for our newsletters and flyers. You can also follow us on Facebook and Instagram. And a couple of housekeeping details. Tonight, to thank you for your participation in our seminar, here's a little picture of our nutrition coupon. We're going to be sending you an email survey link around 8:30. And in it, we're going to ask you to complete some information for us and provide us with your full mailing address, and we will send you a nutrition coupon in the next several weeks. And you can use that for anything in the store for $10 off a $50 purchase. Dr. Sandhu's also got a special offer for participants tonight through his Move Clinic. He's offering a $50 discount on a $100 cold laser therapy session. And he'll be telling you a little bit more about this thank you gift as he walks us through his booking procedures. So for this seminar tonight, you can ask questions using the chat function in YouTube, but you do need to have yourself signed on to your own YouTube account to do that. So if a question goes unanswered, no worries. We're going to leave you an email address for the South Surrey Clinic where you can actually send a question directly through to Dr. Sandhu or to Maria. I've also put their website address up in the chat, so you'll have a written copy of it. Okay, and tonight I am delighted to introduce Dr. Jag Sandhu and Maria Busick. Dr. Sandhu brings over 20 years of experience as a sports kinesiologist and chiropractor and is the owner of Move Health and Wellness with 3 locations in the Lower Mainland. 2 in the Lower Mainland, one in South Surrey, one in more northern Central Surrey, and one in Kelowna. He specializes in bone and joint pain, whiplash injuries, rehabilitation of sports injuries, and mind-body protocols. With him is Maria Busick, and she is a kinesiologist and completed her Bachelor of Human Kinetics from UBC, and she has a Master of Physiotherapy from the University of Sydney. She has over 20 years health and fitness experience, and tonight Dr. Sandhu is going to start us off with a discussion about pain science, and then Maria will take us through some gentle exercises that will teach us how to manage our pain. So let's get started. Over to you, Dr. Sandhu.
Thanks, Darcy, for that wonderful introduction. I think, first of all, we're going to make some assumptions. Last time we did your seminar with you, most of the participants didn't use the chat functions. So the first assumption we're going to make is that, what's your intent? We usually start off a seminar by asking you, why are you here? What would you like to learn? And Maria and I are going to make 3 assumptions. First assumption is that some of you are actually suffering from a pain condition and looking to learn more about pain and using activity to control pain or manage your pain. Secondly, some of you are looking to meet both Maria and I and meet us as therapists and learn about our services. And one of the other assumptions, the third assumption, is that some of you are coming to learn about your specific condition, maybe ask a question about it, and possibly get assessed and diagnosed. So before I get into addressing those 3 interests, 3 questions, I'm going to start with a bit of pain science. I'm just going to share my screen here. So if there's one thing that you remember from today, I'd really like you to remember this diagram. So over on the left side, you have normal tissue. So this graph describes so you can try this on your own, pull your thumb back, and as you pull it further and further back, you're starting to feel stress, you're starting to feel pain, the alarm bell's going off. If you were to go further than it normally bends, then you would tear the tendons and you would sprain your thumb. So that's how basic neuroanatomy. That's how pain science. That's what you want to learn. That's what you want to know how the body works. So when you have an injury, what happens to that alarm bell is it becomes it drops down. So it's the tolerance goes down. So what happens when you once you have an injury, once you pull your thumb back, you're getting alarm bells where they shouldn't ring. You're getting you're taking your thumb halfway and the alarm bell's going off. Oh no, don't go any further. I can't do this anymore. And then if you push through that alarm bell, then you get a flare up to your condition. You're not really going to further damage your thumb, most likely, but most cases you'll get a flare up. You'll have a period of 24, 48 hours, sometimes more, where the injury gets worse and then it calms down. So once you're going through that flare up stage, it prolongs the pain and you go into a chronic pain cycle. So what I want you to learn today is when you're doing the gentle movement exercises, if you're suffering from chronic pain, I want you to think about going just to the alarm bell. So don't push past it, just right up to that level. And then getting back to the questions now. So just sharing my screen again. So you've met both Maria and I as therapists, and some of you are wondering, what other types of services we offer. So if you look at our website, movehealthandwellness.com, we have physiotherapy, chiropractic, kinesiology, cold laser therapy, which is only offered in South Surrey, counseling, acupuncture, naturopathy, orthotics, bracing, and massage therapy. So we have a full team of services that and therapists that work with you on providing therapy and helping you improve your function. So there's the other resource that we talked about is, or the interest is that some of you might be interested in learning more. So Darcy's already mentioned the email address to ask us questions. We'll stay around afterwards to answer some questions if some of you figure out how to use the chat function. But the other option is to click on Book Now. And when you go to our booking site, if you go to the South Surrey site, you'll see our services here, and you just scroll down to cold laser therapy. So we have a $100 assessment that is going to be provided at a 50% off for all the participants here today. So for you or your family member, can get assessed either by myself or our physiotherapist. So depending on your coverage, you may choose one or the other. The second piece I wanted to mention was that you're coming to this one-time workshop, and then you're going to be wondering, okay, I felt great after this workshop. It helped my condition, or the gyms are closed. I want to get into more movement seminars with Maria. How do I get involved? Another resource for you is to book a yoga session or gentle movement seminar with Maria, and we hold them the last Wednesday of every month. So if you click on here, it tells you that the first availability is January 26th, and we go through and book that. Thank you. Now I'm going to hand it over to Maria to take us through the movement workshop. Thank you.
Okay, so now we're going to start with some gentle movement exercises. All you need is your chair, and make sure you're wearing comfortable clothes that you can move in. So I'm going to start now. You're going to start with some gentle squats. We're going to keep our feet shoulder width apart. Gently sit down in your chair and stand back up. When we're doing your squats, I want you to put your hands on your hips for a second. Hinge your pelvis back. Reach your tailbone down towards the chair and stand back up, moving your pelvis forward. Let's do 10 right now. Making sure you're breathing. Inhale here and exhale. Well done. Now we're going to challenge your glutes a little bit more. So we're going to bring your left foot forward, bring your right foot back, hinge through your hips and reach your glutes towards the chair, and then stand back up tall. Work on 10 on this side. That's 2. And 3 more. Well done. And we'll change sides. Bring your left foot back, right foot forward, hands on your pelvis. Reach your tailbone back towards the chair. And we're going to work on 10 on this side. Make sure your knees are staying slightly bent. And 2 more on this side. Perfect, well done. Now we're going to sit in our chair and work on a spinal rotational stretch. Keep your feet shoulder width apart. Bring your left hand on the inside of your left knee, and we're going to rotate, looking over your right shoulder. Take a breath in, lengthen your spine. And as you exhale, you're going to twist. Inhale, breath in. And exhale, twist. One more here. Inhale, breath in. And exhale, twist. And change sides. Bring your right hand to the inside of your right knee. Lengthen your spine and look over your left shoulder. Inhale, twist. Exhale, hold. Inhale here. And exhale. 2 more on this side. Inhale here. And exhale. 1 more inhale here. And exhale. Bring your hands on the inside of your knees, and we're going to work on a thoracic spine bend. We're going to bend our spine forward as we inhale, and as we exhale, we're going to arch our spine back up. Inhale here. And exhale. Inhale. And exhale. Make sure your spine's segmentally curving. So I'm going to ask if you can keep even pressure on the center of your tailbone and even pressure into both feet on the floor, trying to keep notice of the pressure in the center of your heels and the base of your big toes. And inhale, stretch. And exhale, lengthen. Inhale. And exhale. 1 more, inhale, stretch. And exhale. Take your hands in front of you, and we're going to press gently away, breathing in. And as you exhale, push forward. Inhale, push away. Change that hand position. Exhale, push forward. 2 more, inhale, push away. And exhale, push forward. Well done. Now we're going to work on a big breath in. And exhale, push away. Inhale, breath in. Exhale, push away. 2 more, inhale, breath in. Exhale, push away. And 1 more, inhale, breath in. And exhale, push away. Now we're gonna work on a spine bend to the side. So you're gonna have an inhale here. And as you exhale, bring your hand up overhead and spine bend to your right. Inhale to come back to center. And exhale, spine bend to your left. Feel the stretch through your obliques. Inhale, spine bend to your right. Exhale. Inhale, spine bend to your left. And exhale. As you breathe in, you're going to feel your rib cage expand out to your side. Inhaling here. And exhale, push away. Inhale here. And exhale, push away. 1 more stretch forward. Inhale here. Exhale, push away. And inhale here. Exhale, push away. Let's work on your cervical spine. So your neck stretches here. We're going to gently bring your ear to your shoulder. Hold that for 20 to 30 seconds. Just to the first point of resistance, not pain. Once you've held that for 30 seconds, we're going to turn your head towards your armpit, chin down, and hold. Bring your head back to center and repeat to the other side. And bring your chin towards your chest and lower down. Back up to center. Couple shoulder rolls back. Inhaling through your nose. And exhaling through your mouth. Inhaling through your nose. Exhaling through your mouth. And roll forward. Inhaling through your nose. Exhaling through your mouth. Inhaling through your nose. And exhaling through your mouth. Bring your shoulders up towards your ears. Hold there. And relax. And 1 more time. And relax. Gently stretching through your lower back or your lumbar spine. You're going to bring your left foot forward. Keep your right knee bent. Both hands in the center of your left thigh. And we're going to lean forward just until you feel a gentle stretch in your lower back. And hold. Bring yourself back to center and change sides. Bending your left knee, foot on the floor. Lean over your right leg, both hands in the center of your thigh, and hold. This also stretches into the back of your hamstring. You'll feel it up into the center of your glute where the hamstring attaches. And we're going to come back to center. Both hands, we're going to bring your feet out a little bit wider than shoulder width apart, toes pointed out at a slight angle. We're going to bring your hands to the center of your knees, and we're going to arch through your thoracic spine again through this motion here. So you're going to get a deeper stretch into your thoracic spine. Inhale here. And exhale. Lengthen your spine up toward the ceiling. Inhale here. And exhale, make sure you're pressing your hands into your inner thighs. Inhale here. And exhale, lengthen up. 1 more inhale here. And exhale, lengthen up. Bring your legs back to center. We're going to stand up and move our chairs sideways. We're going to stretch through our lower back and our hamstrings. So hold on to the back of your chair. Keep your feet shoulder width apart and gently stick your glutes out. Bring your chest down towards the chair and hold. You'll feel the stretch into your lower back and into your hamstrings. Keep your knees gently bent, so a slight bend there, and hold. And you're going to bring your left foot forward, right foot back. We're going to stretch through the front of your right hip and your calf muscle. We're going to hold here. Lengthen your spine upwards, bending your left knee. You'll feel the stretch into the back of your right calf and a little bit in the front of your right hip. Bring your right foot forward, left foot back, and hold here. Stretching into your left calf and a little bit into the front of your left hip. Bring your feet back to center, slightly wider than shoulder width apart, and we're going to work into a little bit of movement here. Squats, reaching your tailbone back and standing up tall. Inhale and exhale. Strengthening through your quads and your glutes. Try to keep your squats about parallel to the ground. We're going to work on 5 more here. And there we go. Feet together now. We're going to work on a calf raise, lifting your heels up, slowly lowering down to parallel. Lift those heels up as high as you can go and slowly lowering down. We're going to work on 5 more here. Well done. Now we're going to keep our feet shoulder width apart. Turn your toes out so they're in a V position. We're going to work on a sumo squat. Keep your hands in the back of your chair. Inhale, lengthen your spine, and exhale, squat. This is strengthening through your inner outer thighs as well as your glutes. We're going to keep our core strong while we're doing all of our movements here, gently bringing your navel in towards your spine. So that's going to help you strengthen your muscle called your transverse abdominis, your lower abs. 5 more sumo squats here. Well done. We're going to go through 1 more set of your calf raises. Inhale, lengthen your spine up. And exhale, let's start rising those heels up off the floor and lower. Inhale as you rise, exhale as you lower. Five more here. Well done. Now stretch those calves out. Bring your left foot back, right foot forward, and hold that stretch. Putting even pressure into the center of your left heel as you lunge forward. Bringing your knee towards the chair, your right knee. Keep your back nice and straight. Don't round your shoulders forward. And change sides. Left foot forward, right foot back. Even pressure into the center of your right heel. and lunge your left knee towards the chair. Now to lengthen through your soleus muscle, we're going to bring your left foot back, right foot forward, bending your right knee towards the chair. Bend your left knee slightly and you'll feel the stretch deeper into your calf. Inhale here and exhale, hold. Well done, change sides. Keeping a slight bend in the right knee, heel down towards the floor. Bend your left knee towards the chair. Inhale. And exhale, hold. Both feet back to center. Well done. One more set of squats. Bring your feet shoulder width apart. Reach your tailbone back. And standing up nice and tall. Strengthening again through your quads, glutes, hamstrings. If you want to strengthen through your glutes, we're going to go a little bit below parallel into a deeper squat. If you're feeling a lot of discomfort today, just keep that into a semi-squat position above 90 degrees. Or gently to 90 degrees. Work within your comfort level. And together we're going to do 5 more. Well done, and one more stretch for your hamstrings and your lower back, holding onto that chair. Hinge your hips back. Chest down and hold. You'll feel a gentle stretch into your lower back and into your hamstrings. Inhale. And to deepen that stretch, we're going to exhale, drop our chest down a little bit more towards the chair. Slowly coming up out of that stretch. We're going to stretch through our obliques, so into the side of our torso. Bring your left foot forward, right foot back, holding onto the chair. Inhale here. And as we exhale, we're going to side bend towards that chair. With every inhale, you're going to feel the stretch into your rib cage. And exhale, push away. Let's go into that stretch one more time, leaning towards the chair. Inhale, breathe in towards your rib cage. And exhale, try to stretch a little bit further and push the hand away. And we're going to work onto the other side. So we're going to cross, bring our right foot forward, left foot back. Inhale, step. Exhale, down. Inhale, reaching into that rib cage with each breath. Exhale, down. And one more, inhale into your rib cage. And exhale, down. So you should feel both of those stretches right into your obliques and into your rib cage, into your intercostal muscles there. Let's bring our chair back to center. Sitting back down. We're going to breathe and strengthen through our transverse abdominis. So we're going to place both hands just below your belly button into your lower abdominal muscles here. I want you gently bringing your navel, so your belly button in towards your spine. You're going to take a breath in here. And as you exhale, draw those lower abdominal muscles in, and you're going to hold for 5, 4, 3, 2, and 1. Release. Strengthening through your transverse abdominis muscle, your lower abdominal muscles, is going to help support your lower back, prevent occurrences of low back pain, and help you progress better through your exercise regimen. We're going to try this one more time. Bring your navel in towards your spine. Take a breath in. And exhale, hold. Try to keep breathing while you're holding that exercise right now. Hold here. And we're going to hold for 5, 4, 3, 2, and 1. Release. When you're holding that contraction, you should feel your muscles gently draw in towards your spine. You should feel a gentle tightening across your lower abdominal region, and it should be comfortable to hold. Thank you very much. We're finished our exercises for today, and I'll bring it back to Darcy.
Thanks, Maria. That was great. It's really nice to have a way to get some movement in the confines of our home. So I should have added earlier, none of us are wearing masks, but we're all alone in our own environments here. But with gyms being closed and whatnot, it's really great to be able to get some movement. So thank you very much, Maria. So we don't have any questions here. So I just did want to share a little story with you before we close. I did dislocate my right shoulder in the summer of 2019 in a silly accident with my daughter in Winnipeg. She was helping me up a big step and she pulled too hard and I started to fall and anyways, dislocated it. So it was obviously treated in the emergency room. And I came back and I went to Move Clinic for physiotherapy and cold laser treatment. And I was just delighted at how quickly I healed. And within a few months, I had full mobility and motion and usage back. So cold laser is something really amazing in my books. And I think if you can take advantage of Dr. Sandhu's generous offer and you've got any sort of pain issues, it's really worth looking into. And Jag, maybe you could just talk a little bit about what cold laser can do for what types of pain, because it's not just new injuries such as what I endured, is it? It can be long-term things or even scar tissue type things, or maybe you could chat a little bit about that.
Yeah, cold laser is helpful for both acute and chronic conditions. The two most common conditions that we treat are, first of all, osteoarthritis, so wear and tear of the joints. What cold laser does, so if you have some arthritis in your knee, for example, the cartilage is wearing down, the cold laser can actually regenerate that cartilage. So that's how you get better in our clinic. And there's over 5,000 studies to prove and validate the effectiveness of cold laser therapy. But if you let it slide to a more moderate, severe stage, then obviously you're a surgical candidate. Then some of you maybe already have seen orthopedic surgeons and you've got knee replacements or hip replacements. But if it's a mild, moderate condition, then we can regenerate that cartilage and get you back to normal. The second condition is internal scar tissue. So if there's damage from a car accident or an injury, sometimes scar tissue develops. And the way I like to describe it is, think of cutting your hand and then a scab forms. That's basically what happens with an injury. The scab forms inside your body and it restricts mobility. So sometimes have patients coming in, I keep getting re-injured because that scab just breaks and forms again. And it's just a chronic cycle. So patients come in with chronic pain. So what the cold laser does is it removes that unhealthy scar tissue and lays down healthy, elongated, elastic tissue to help you recover from your injury. The other thing that's really interesting with pain science, I talked about one area where moving that bell, improving your tolerance, but the cold laser also helps with, because your nerves are hypersensitized, it helps desensitize them. Your nervous system is overactive after chronic injury, so the cold laser helps with that as well. So those are two common conditions that we see in the clinic. And as Darcy mentioned, it could be acute, a new injury, or it could be chronic as well. And generally, the younger, healthier patients obviously respond a lot quicker, and more age, older patients, more chronic injury takes a little bit longer. But the combination of exercise and the cold laser therapy, we find the best results. Thank you.
Yeah, so true. And I remember coming out, and your clinic is so close to my place of work here. I would walk back to work and I would feel immediately some improvement after each session as well. And I did do my exercises. I was well behaved. So that was all good. Maria, do you want to offer any final comments on any of your exercises that you've done tonight?
Oh, thank you. These exercises are very easy for you to do. We're going to be offering these seminars, like we said, once a month, and you can practice them in the comfort of your own home. They're going to help you release any soft tissue that's a little bit tight and help you be able to manage your pain better. So I'd recommend you trying to do them once a day. If you can, twice a day, that would be great. Holding each, the stretches, hold them for about 30 seconds long, especially the neck stretches and your lower back stretches. Those areas tend to get quite tight in a lot of people that have injuries or chronic pain. And it's good to help you strengthen through your core, your glutes, and your hamstrings as a preventative measure. If you have any other questions, you can let me know in the clinic. I also offer assessments and treatments there.
That's wonderful. Thank you. And Dr. Sandhu, any final words from you tonight?
I know Maria really wanted to get into light weights and gym balls. She's really passionate exercise therapist. So I asked her to kind of keep this first session simple, but the next one you can expect bring your light dumbbells, your gym ball, tubing, whatever you have, and she'll work with you on at the end of the month on January 26th. Thank you.
That's just great. It's amazing how the pandemic has really shifted things, and we're also very resilient now, aren't we? We work from home, we exercise from home, and it's a whole new frontier, which I think is great. It makes things much more accessible to so many more of us. So anyways, thank you all very much for coming tonight. And I've put some details into the chat for website, addresses, and I've reiterated the generous offer from Dr. Sandhu for some cold laser therapy. And I've also got the email address if you have any follow-up questions to the seminar tonight. So I encourage you to take a look through the Move website and see if any of the other services might be a good fit for you as well. So I've been very happy with how well I've done with these people. And they're near and dear to me for sure. So anyways, thank you all very much for coming, and we hope to